everyone, welcome to another episode of our Wellness Exchange series. Today I'm joined by Dr. Yvonne Quintanilla from South Texas Health System, and today we're going to focus on depression. So Dr. Quintanilla, thank you so much for being here with us again. Thank you for joining us.
Thank you for having me here.
Well, let's start with the main question. What is depression, Dr. Quintanilla?
Oh wow, depression. Depression is a combination of a couple of factors. We're talking genetics, the genetics like the family history, the biology part of it, the biological part of it, the environmental factors affecting you, and all the psychological factors affecting you. So we're talking about the genetics, the biological, environmental, and psychological factors. That's what depression is comprised of.
Can you elaborate a little bit more on the postpartum depression?
Postpartum depression, there's several pieces to postpartum. I want to make sure that we understand that. First of all, there's something called the baby blues. Okay, the baby blues starts with something as it could be something that lasts like maybe a day or two, maybe a week, maybe 2 weeks at the most. And we're talking about different symptoms like anxiety, irritability, insomnia, probably because of the baby, appetite changes, like I mentioned earlier, irritability. Those are just a few, but remember, the baby blues normally are like a day or two, a week, maybe 2 weeks. So that's one. But then we move on to postpartum depression. Those are more severe and intense. And we're talking about severe and intense symptoms of anger, irritability, severe insomnia, severe appetite changes. And these symptoms, some of them start like right before, you have the baby, during your pregnancy, and then after, and they continue. And some of this continue for a year or maybe even more. Those are severe symptoms, and I just gave you a few of those symptoms. But then there's another area that's probably going to be a surprise to most people. Men develop these symptoms as well.
That's really interesting.
And men, on the other hand, these are usually young men that develop these symptoms. And they call it paternal postpartum depression. And the way that works is that fathers usually who are young, and they'll have a history of depression, or they're having relationship problems, or even financial problems. Those things trigger a lot of the postpartum depression. But let me talk a little bit about some of the symptoms for postpartum. I know I mentioned a few, but I want to mention a couple of other things. When it's severe postpartum depression, a lot of women will go through a very severe depressed mood or mood swings. That's important to note. They'll withdraw from the family and friends. Some of them will have a paralyzing fear that they're not a good mother. And some of them start feeling worthless, hopeless. Some of them will actually have problems focusing, concentrating. They'll feel guilty because they feel like they're not being a good mother. They feel inadequate. Some of them even have thoughts of harming themselves or the baby. And some of them have thoughts of suicide themselves. Those are the severe cases of postpartum depression. I wanted to make sure I brought that to your attention.
Definitely, that's really important, and I like how you explain us on the different, I guess we can call them different stages or different types of postpartum depression. And it's really interesting that you mentioned about that men can also experience this type of depression. And definitely having a baby is a completely
very stressful situation.
It's a big change. Definitely.
It is, yes. A lot of these young families, they're learning to, oh my gosh, there's a new person in this house. Did you check the baby? Is he breathing? Those kinds of things. So it's an adjustment.
Definitely. And what about seasonal depression, doctor?
Okay, seasonal depression. Depression. I'm glad that you thought about that. When I saw this, I thought, okay, I remember this. I remember when I lived in Ohio, I rented a home, and in the home, I remember in the basement, they had a special light. And I remember being told, whenever you go through the winter months, remember you have your basement light. And I thought, okay, I didn't think anything of it. I'm from Texas. I mean, what's the big deal?
Sun.
So then I learned that this special light is a light that is used to help give you the energy, to help, because of the lack of sunshine during those winter months. When we're talking about seasonal affective disorder, it's a condition in where there's a shift from the long days of lots of sunshine to shorter, darker winter days. And one of the things we need to remember is if you've ever lived north of the 42nd parallel, you've heard of seasonal affective disorder. It's not just a fancy term for winter, blues. It's actually a documented medical condition. And this condition affects these people in the late fall and winter. It causes symptoms like depression, a lack of energy, usually insomnia, and feelings of hopelessness. And it's all due to the short winter days. And it's important to know that because of the lack of the sunlight, the serotonin, the melatonin, that affects us in general. So I wanted to point something out to you. First of all, that there are several states that experience this. A lot of people that live there experience this. And those are states like Alaska, Washington State, Oregon, Ohio, Upper New York. Those are the states that usually experience the dark, gloomy, and most of them have less than 30% of direct sunlight. During the months of November, December, January, February, those are the months that are most affected. But on the other hand, we have what we call the sunny states. And those are like Texas, Arizona, New Mexico, Hawaii. Those are the states that have the best and the sunniest winters. That's why we here in Texas, we get the winter Texans, because folks from those states usually come down to the sunny states to, I guess, rejuvenate themselves with that energy, with that sun, those kinds of things.
Definitely, and of course, this in the United States, you mentioned some of the states that are being affected, but of course this happens around the world, and there's some other countries that also experience it. I was actually mentioning to you before we started recording how when I was living outside in London, to me that terminology was new, because in Texas, like you mentioned, we're a sunny state, so we don't experience those things. But when I went and lived there, definitely there was a lot of discussion and conversations, which to me was something really good, because at least people were talking about it, right? It's not something that, oh, it's raining and you're sad and it's okay, but it's something that actually, dark So I found it really, really interesting, Doctor. Would you be able to tell us a little bit more about the different types of depression? So we have already talked about postpartum depression, seasonal depression, but there's different stages. Maybe that's
I can list a few of them for you. There's a major depressive disorder. They also call it MDD. Okay. There's the bipolar depression. And then there's the postpartum, which we just talked about. There's the premenstrual disorder, okay? That's usually affects women and usually young girls, where they experience very painful menstrual periods, where it's very difficult for them just to get out of bed, and it's very difficult for them to function. There's also the psychotic depressions. Those are where they're either having delusions, hallucinations, That's one of the disorders. And then the seasonal affective disorder, which we just talked about. And well, those are just a few.
So for those different types of depressions that we have just discussed, are there some common symptoms that patients experience for
Yes.
depression?
Okay. Depression's different. It varies person to person. Okay. You'll see that some people are at like different stages of depression. You know, the symptoms can include anything from losing interest in the things that you used to love to do. Like you used to play the guitar all of a sudden and then you just stopped. You used to love to paint and then you just stopped. You used to like to go walking and then you just stop. You just don't have the energy, you just don't want to do it. Or you feel lethargic, you know, and very fatigued, where it's very difficult to get out of bed. You literally have to force yourself to get out of bed, where your body feels heavy, with just like weighted down. It could be where you feel like what we call brain fog, cloudiness in your head, where you feel like a lot of guilt. You've lost the desire to have sex, okay? You feel hopeless, worthless. You can't seem to get past feeling helpless. Some of them will get, you know, severe body aches. They'll feel pain. They feel very stressful. They feel paralyzed with fear. Some of them, the depression will go as far as people having suicidal thoughts about hurting themselves, you know, where they actually will eventually develop a plan to hurt themselves, that kind of thing. They have insomnia, they'll have poor concentration, trouble focusing, trouble being productive at work. Those are some of the symptoms of depression. And when you start seeing some of those signs, it's important to go see a doctor or a mental health therapist to help you process what is going on in your life and help you learn to manage it with a good treatment plan.
Definitely, and I like how you added that it's so important to seek that medical treatment and that support, because definitely we need help, right? And it's okay to ask help. So what are some of the recommendations that you have when someone is experiencing those type of feelings, that sense of helplessness and lack of interest, like you mentioned? What are some of the recommendations that an individual can do to either improve those symptoms or seek help?
Well, there's a couple of things that you can do. First and foremost is look for help, okay? If you can get to a doctor, okay, now we have telehealth where you can go online and find a doctor. We even have telehealth where you can see a psychiatrist as well, or even a therapist. So those options are there, you know, for online. But there's also maybe you have a primary doctor and the doctor has your medical history. Go to your doctor, sit down and, you know, if you go see a doctor, take a list of all the things that you're going through. It really helps a doctor when you walk in there and you say, "Doctor, on Monday I felt like this, on Tuesday I felt like this, I've been feeling like this for several days." Remember, when we're talking about depression, this is something that's, you know, several symptoms that are affecting you and your quality of life. So it's important for you to give the doctor as much information as possible so he has something to work with. And then the doctor can either connect you to a therapist or to a specialist, or maybe he can help produce a treatment plan for you as well. In some cases, they will probably recommend therapy and medication. In some cases, they just, you know, recommend therapy. And when you go see a therapist, it would be good to ask them, do you do any cognitive behavior therapy? What kind of therapy do you do? Is it solution focused? I mean, what kind of therapy do you think that I need to help me with what I'm going through right now? So those are things for you to think about and to ask when you go see a doctor and a therapist.
I think those are great points. And also, a couple of minutes ago, you did mention about how when someone that you know, or a family member, maybe a friend, is experiencing those, also encouraging them to seek help. Would you be able to elaborate a little bit more on that? So maybe it's not the individual per se that is having those feelings, but it's someone that they care about and they want to help. What are some of the things they can do?
If you see someone, maybe you've noticed that they're having these symptoms, maybe the insomnia you've seen, maybe the weight gain or the weight loss, or maybe the irritability, the anger, the frustration. Something is going on with that person. If you see it 1 day or 2 days, you know, okay. But if you're seeing this and it's been like a couple of weeks, something is going on with that person. It would be really good for you to sit down and just have an open, honest discussion with them. Hey, I'm seeing, you know, a couple of changes in you. Is everything okay? Tell me, what can I do to help? Offer support and encourage them to see a doctor, a therapist, or someone that can help them process whatever it is that they're going through. But just opening up to them and having that discussion with them, but not to forget that you need to continuously encourage them. That should help.
Definitely. And you did talk a little bit about the treatments about depression, which included the pharmaceutical one, and also the therapy. But would you be able to elaborate on which ones are the most efficient? And probably it's individual based, so maybe there's no right answer.
Like I said, every case is different. It varies from person to person, depending on the situation. For example, if you're working through anxiety, okay, I'll just use that as an example. If you're working through anxiety, when you go and you speak to your doctor, you can tell them, I'm having anxiety, I've been having anxiety for the past week or two, I just can't shake it, what can I do? The doctor's gonna, you know, sit down and obviously sit with you and do a good evaluation to determine what the next step is. If you go see a therapist, the therapist is going to do the same thing. She's going to do a good evaluation on you to determine a good, you know, a good strategy for you. And together, both of you would work on a treatment plan. And then she will teach you how to best manage it. With anxiety, it could be as simple as identifying a trigger. Okay, once you identify that trigger, then you need to identify, okay, so this is my trigger. Oh my gosh, the phone is ringing. It's a bill collector. I don't have the money to pay the rent. What are the feelings that you're feeling? You're feeling stress, nervousness, you know, shortness of breath, all these things. But then what is your reaction? Your reaction could be you're not answering the phone, you're paralyzed with fear, you don't know what to do, you shut down. So what a therapist would do is they would sit there and they'd help you process that. They'd help you identify the trigger, what is causing this trigger, what are the feelings that you're feeling, they'll help you process that, and then the reaction. And then the therapist would also help you, like, what do you think that we can do to help improve this situation? Those are some of the things that a therapist can do with, you know, with whatever issue that you're going through.
So, Dr. Quintanilla, what are some of the things that need to be done when there's an emergency, whether it's for themselves or for others?
When you're in a situation where there's an emergency, okay, and this person, let's say, is suicidal. I'm just using that as an example. Or they're in crisis, some kind of crisis, and you just happen to come across this person. It's important, first thing and foremost, call 911. Okay, they will know what to do. All right, so it's really important. And then the next thing I want you to remember is to try to keep that person very calm and stay with them. Do not leave them. So you call 911, try to keep the person calm, stay with them, okay? Ask them, is there someone that I can contact for you? If they say yes, then do so. If they say no, then don't. Respect that. Do not judge them. do not criticize them. They're in crisis. This is not a moment to judge them and criticize them. Sometimes they just don't know where to start. And sometimes they lack the courage, or they don't have support, social support. So just encourage them to seek help. And when help arrives, they will take over. What you need to do after that is check yourself. Find help for yourself, because that incident just created anxiety for you, maybe stress, and you need to decompress as well. So remember, call 911, stay with them, help them stay calm, okay? Ask if there's a support system or someone that they need to contact, okay? Encourage them to get help, okay? And of course, when they show up, they will take over, 911 will take over, and then you get help for yourself.
And I guess just as a final question, if we can just talk about some of the lifestyle changes that an individual can do to manage depression or to help with some of the symptoms of depression.
Lifestyle changes. Lifestyle changes can be as simple as taking care of yourself, okay? It can be as simple as learning to find balance in your life. Understanding that work is work, and then there's family, okay? And then, there's your life, okay? You can't get lost. It's very easy for us to get lost in our work, where we let work consume our life. That's important. And you need to understand too that your family is your family, yes, but you have your own identity as well. Learning to take care of you as well. And because if you're happy, then, that old saying, if you're happy, everybody's happy, that kind of thing. Learning to eat a balanced diet, remembering to exercise, remember to taking care of your own mental health needs. Those are important. Getting physical activity, your exercise, which we talked about earlier, making good choices about alcohol and drugs, getting help if you're feeling anxious or depressed, not being afraid to ask for help is really the big piece right here. But other things you can do are just staying connected with your family, with your friends, finding ways to reinvent yourself, learning to appreciate yourself, to value who you are as a person and what you have to offer your family and your community. Those are important things. And another thing that we all forget about is learning to give of yourself. Do some volunteer work. It is such a good feeling. It's very rewarding to do good things for others because it comes back to you twofold or so.
Definitely. And one of the big pieces that you mentioned is self-care. And I like to think about self-care as an investment. And we're investing in ourselves, but at the end, it's also going to have a positive effect on others and on the people that we are in touch with, our family members, friends, and even the co-workers, like you mentioned. We do have different aspects of our life, and making sure that one is well first is definitely really, really important. Well, thank you so much, Dr. Quintanilla. Thank you for joining us and for allowing us to have this conversation with you about this important topic. Thank you so much. Well, thank you so much, everybody, for watching. Thank you for joining us in this conversation about mental health. If you want to learn more about these health and wellness topics, I invite you to subscribe to our Hidalgo County Wellness Program channel and continue to watching our Wellness Exchange series. Thank you and have a great day. Stay healthy and stay safe. Thank you.